Good afternoon, ladies and gentlemen, and thank you for standing by. Welcome to the Ovarian Cancer Conference call titled, On the Move, Benefits of Exercise on Your Ovarian Cancer Journey. At this time, all participants are in a listen-only mode. Following the presentation, we will conduct a question and answer session. Instructions will be provided at that time for you to queue up for questions. If anyone has any difficulties hearing the conference, please press the star followed by 0 for operator assistance at any time. We'd like to remind everyone that this conference call is being recorded on Tuesday, October 7th, 2008 at 1:30 p.m. Eastern Time. And I will now turn the conference over to Fran Turner, Program Director. Please go ahead.
Welcome. Ovarian Cancer Canada welcomes you to this session of our telephone education series for women with ovarian cancer and their caregivers. Today's session is On the Move, the benefits of exercise on the ovarian cancer journey. We know that today's speaker will provide you with helpful information about the effects that exercising can have on both the body and the mind. And there will be an opportunity for listeners to ask questions or give comments after the speaker has finished her formal presentation. I'm Fran Turner, Program Director of Ovarian Cancer Canada. Ovarian Cancer Canada endeavors to provide women with ovarian cancer and their caregivers the information that they need. We hope that you will find this session interesting and that you will address your questions to our speaker. To encourage listeners to ask questions, you can just give a first name and feel free to provide the operator with an alias if you wish. We want to ensure that your confidentiality is maintained. The previous telephone education sessions are available on YouTube at www.youtube.com/Ovarian Cancer Canada. And you will be able to listen to this session and our past sessions. I would like to acknowledge Alianka Scoop for her translation work today, and a reminder for all of us to speak slowly so that she can do her work effectively. We're delighted there are survivors, family members, and healthcare professionals from across the country in the audience, and we hope that you can help us with your feedback. An evaluation form will be sent to attendees via email or regular mail, because we'd appreciate your thoughts about today's session. Now, today's session on the benefits of exercise. Dee Miller is the founder and executive director of Renewed Strength Incorporated, a registered charity designed to help cancer patients regain their strength and mobility after cancer treatment. She is an ACE certified personal trainer and a group fitness instructor and owner of Fitness Delight, a personal training and fitness consulting company. She is also involved in the Cancer Patient Education Network and is involved in medical facilities in North America as through her committee work on this network. So, Dee, please take it away.
Thank you so much, Fran, and welcome everybody. I'm going to go through On the Move, the benefits of exercise on the ovarian cancer journey. I'm going to speak nice and slow, slower than I usually do for translation. So please, if you have any questions, wait till the end, write them down now, and then we'll be able to get to the questions at the end. So exercising cancer. How can I possibly have the strength to exercise when I'm too tired to get out of my chair? As a cancer survivor, I know that feeling, and I can totally understand how you feel. We know that exercise will help, but why bother? I've never exercised before. Why start now? Well, we know that research shows that rather than rest, aerobic exercise and strength training have emerged as keys in reducing the fatigue and pain that accompany cancer treatment. From the Journal of Oncology, we know that women have found to be less active physically during the first year after diagnosis. So fatigue. Dealing with fatigue, it's totally debilitating to us to be able to move when we have fatigue. We know that fatigue occurs in 3 out of 4 people with cancer. Anywhere from 30 to 90% of people with cancer and after cancer treatment suffer from fatigue. Current treatment fatigue is one of the most disruptive aspects of treatment in the majority of cases because of its significant contribution to the decreased quality of life in people with cancer. It is often described as overwhelming, unpredictable, intense, severe, and relentless, and often leads to a decline in emotional, physical, and psychological function. Fatigue may affect how a person feels about themselves, their daily activities, and relationships with others. Now, we know that fatigue may be acute or chronic. We know that normal tiredness with occasional symptoms that begin quickly and last for a short period of time are usually considered acute fatigue. But when this fatigue is prolonged, debilitating, and may persist or relapse, it's often described as chronic fatigue. Now, it is not always possible to determine what causes fatigue. There's a lot of possible factors, including the treatment itself, anemia, changes in the metabolism, loss of appetite, and weight loss. We know that different medications, inactivity, difficulty sleeping, loss of strength and muscle coordination, pain, emotional distress, and infection all can contribute to the fatigue. Most of the treatments for fatigue are treating the symptoms and providing emotional support. Treatments for fatigue include different psychosomatic stimulant drugs, treatment for anemia, exercise, activity, and rest programs and patient education. With fatigue, it is very important to start that very slow cycle of doing a little bit now, doing a little bit more, and a little bit more. We want to start that positive cycle instead of sitting, too tired to do anything else and sitting longer, and again, too tired and sitting. We know with atrophy, if you look at somebody who's broken an arm, 1 month, a month and a half in a cast, that cast comes off, we can see how much smaller that arm is. But when we have been inactive for a whole month, 2 months, 3 months, even longer, we don't see in our whole bodies how much they've atrophied. When the muscles atrophy, your breathing changes, the whole support system of your body changes. So this is a major thing that we need to look at as far as exercise after and during cancer treatment. We all know the benefits of exercise. It's usually not enough to get us out there exercising, but as a reminder, when a person has spent a lot of time going through medical treatments, such as surgery, radiation therapy, and chemotherapy, they're not left with much energy to do anything, especially daily activities. This usually means they spend a lot of time resting, which causes the body to become inactive and the muscles tend to weaken and atrophy. As soon as they have finished treatment or recovered from their surgery and feel strong enough, and after the doctor gives permission, which is very important, exercise with adequate periods of rest should be incorporated into the daily life, but very slowly. You do not want to go out there, you're feeling great, and do a whole bunch, because it'll have a negative effect. It needs to be a positive cycle of moving forward by doing a little bit today, then a little bit more each day, a little bit more each week, and a little bit more each month, with a little bit at a time being so important. Now, even the most minimal amount of exercise can help to give you strength. So it's very important to choose activities that you enjoy, and you'll be more likely to stick with it. Now, exercise can be beneficial for a number of reasons, such as increasing your muscular strength and endurance. This helps enhance your performance in everyday activities, things such as climbing up the stairs, putting the groceries away, turning door handles, being able to make the bed, these easy things that are part of your daily activity. Improved aerobic endurance and physical stamina. Being able to walk to the corner, and then a little farther, and then a little farther. Improved body composition. Improvement of posture and muscle balance. We know that 2 of the main problems that we're dealing with after cancer surgery are posture and muscle balance.